I'm Dr. Jocelyn, and today we're diving into something that's been creating quite a buzz in the health community lately. We're talking about a simple, affordable vitamin that you can put right under your tongue, and it might just change the game when it comes to supporting healthy testosterone levels after you hit the big five. Now, before we get into the specifics, I want you to grab a comfortable seat because what I'm about to share with you today is going to challenge some of what you might have heard about testosterone support. And trust me, by the end of this video, you're going to understand why the sublingual method, that's putting something under your tongue, is becoming the preferred choice for so many men who are serious about their vitality. Let me start with a story. Just last month, I had a patient come into my office. Let's call him Robert. Robert is 56 years old, works in construction, always been active, always been strong. But lately, he told me he'd been feeling off. His energy was tanking by mid-afternoon. His workout recovery was taking longer, and he just didn't feel like himself anymore. His words, not mine. Sound familiar? Well, Robert's story is the story of millions of men over 50, and it all comes down to one crucial hormone, testosterone. Now, here's the thing about testosterone. After you turn 30, your testosterone levels naturally start declining by about 1 to 2% every single year. Do the math with me here. By the time you're 50, you could be looking at a 20 to 40% drop from your peak levels. That's significant. That's life-changing significant. And this decline doesn't just affect your energy or your muscle mass. We're talking about your mood, your cognitive function, your bone density, your cardiovascular health, and yes, your intimate relationships too. But here's where it gets interesting, and this is what most people don't understand. The problem isn't always just about how much testosterone your body is producing. It's also about how well your body can actually use what it's producing. And this is where our star ingredient comes in. Let me introduce you to vitamin D3. Now, I know what you're thinking. Vitamin D? That's the sunshine vitamin, right? What does that have to do with testosterone? Well, let me tell you. The connection is far more powerful than most people realize. And the research backing this up is absolutely fascinating. Vitamin D is not technically just a vitamin. It's actually a hormone precursor, which means your body uses it to make other hormones, including testosterone. Multiple studies have shown a direct correlation between vitamin D levels and testosterone levels in men. In fact, one landmark study published in the journal Hormone and Metabolic Research found that men who supplemented with 3,332 international units of vitamin D daily for 1 year saw their testosterone levels increase by approximately 25%. 25%. That's not a small bump. That's a significant, measurable, life-changing increase. But here's where the sublingual method comes into play, and this is crucial. When you take vitamin D orally, meaning you swallow a pill or capsule, it has to go through your entire digestive system. It gets broken down by stomach acid, processed by your liver, and only then does it enter your bloodstream. This process can take hours, and you lose a significant portion of that vitamin along the way. Studies suggest that oral absorption rates for vitamin D can be as low as 50% in some individuals, especially in those with digestive issues or as we age and our digestive efficiency decreases. Now, when you put vitamin D under your tongue, something remarkable happens. The mucous membranes under your tongue are incredibly thin and highly vascularized, meaning they're packed with blood vessels. When you place a sublingual vitamin D supplement under your tongue and let it dissolve, those active compounds are absorbed directly into your bloodstream, bypassing your digestive system entirely. This means faster absorption, higher bioavailability, and more of that precious vitamin actually making it to where it needs to go. We're talking about absorption rates that can be up to 90% or higher, and you start seeing effects within 15 to 30 minutes rather than hours. Now, let's talk about dosing for a moment because this is where a lot of men get confused. The recommended daily allowance for vitamin D is 600 international units for most adults. But here's the problem with that recommendation. It was designed to prevent deficiency diseases like rickets, not to optimize hormone levels for testosterone support. The research suggests that most men over 50 need somewhere between 2,000 to 5,000 international units daily, depending on their current levels, their sun exposure, their body weight, and their individual health status. And here's something else you need to know. If you're deficient in vitamin D, and statistically speaking, about 42% of American adults are, you're not going to see optimal testosterone production no matter what else you do. But vitamin D doesn't work alone. And this is where we need to talk about the supporting cast of ingredients that can amplify its effects and create a comprehensive approach to testosterone support. Let's talk about zinc next. Zinc is absolutely critical for testosterone production. It's involved in the conversion of cholesterol into testosterone, and it also helps inhibit the enzyme aromatase, which converts testosterone into estrogen. Now, here's the problem. Zinc deficiency is incredibly common, especially in older men. Studies have shown that zinc supplementation can increase testosterone levels significantly, particularly in men who are deficient. One study found that men with low testosterone who supplemented with 30 milligrams of zinc daily for 6 months saw their testosterone levels nearly double. That's powerful stuff. The sublingual delivery method for zinc is particularly interesting because zinc can be harsh on the stomach when taken orally, causing nausea in some people. But when you take it sublingually, you bypass the stomach entirely, reducing the risk of digestive discomfort while improving absorption. The ideal form for sublingual use is zinc citrate or zinc gluconate, as these forms dissolve well and are highly bioavailable. Now, let's talk about magnesium, another often overlooked mineral that plays a crucial role in testosterone production. Magnesium is involved in more than 300 enzymatic reactions in your body, including several that are directly related to testosterone synthesis. Research has shown that magnesium supplementation can increase both free and total testosterone levels, especially in men who exercise regularly. One particularly interesting study found that athletes who supplemented with magnesium saw a 24% increase in free testosterone levels after just 4 weeks. The sublingual form of magnesium, typically magnesium chloride, is absorbed exceptionally well through the oral mucosa. And because magnesium also supports sleep quality, and we know that testosterone production peaks during sleep, you're getting a double benefit here. Poor sleep is one of the fastest ways to tank your testosterone levels. By supporting healthy estrogen metabolism, boron helps maintain that crucial balance between testosterone and estrogen that's so important for male vitality. The sublingual delivery of boron ensures rapid absorption and utilization. Because it's needed in such small amounts, a sublingual tablet can deliver the perfect dose without any risk of overdoing it. And you'll feel the effects much faster than with oral supplementation. Next up, let's discuss vitamin K2, specifically the MK7 form. Now, you might be wondering what vitamin K has to do with testosterone, and the connection is fascinating. Vitamin K2 plays a crucial role in directing calcium to where it belongs, your bones and teeth, and away from where it doesn't belong, your arteries and soft tissues. But recent research has uncovered another role. Vitamin K2 appears to stimulate testosterone production in the Leydig cells of the testes. Animal studies have shown significant increases in testosterone production with vitamin K2 supplementation. And while we need more human studies, the preliminary evidence is very promising. The reason we specifically want the MK7 form is because it has a much longer half-life in the body compared to other forms of vitamin K, meaning it stays active in your system longer and provides more sustained benefits. When delivered sublingually, vitamin K2 MK7 bypasses first-pass metabolism in the liver, which means more of it remains in its active form and available for use by your cells. Now, there's another ingredient that deserves our attention, and that's fenugreek extract. Fenugreek is an herb that's been used for thousands of years in traditional medicine, but modern science is now validating what ancient healers knew all along. Fenugreek contains compounds called furostenolic saponins that appear to stimulate testosterone production and, importantly, help free up bound testosterone so more of it is available in its free active form. Clinical studies on fenugreek are impressive. One study found that men supplementing with fenugreek extract saw significant improvements in sexual function, energy levels, and overall well-being, with corresponding increases in free testosterone levels. Another study showed improvements in strength and body composition in men taking fenugreek while resistance training. When fenugreek is delivered sublingually, its active compounds are absorbed quickly and efficiently. The typical sublingual dose ranges from 300 to 600 milligrams of a standardized extract, and men often report noticing effects within a few weeks of consistent use. Let's also talk about vitamin B6, particularly in its active form, pyridoxal 5-phosphate. B6 is crucial for the production of neurotransmitters and hormones, and it plays a specific role in regulating prolactin levels. Here's why that matters. Elevated prolactin can suppress testosterone production. By helping to keep prolactin levels in check, B6 indirectly supports healthy testosterone levels. Studies have also shown that B6 supplementation can improve mood and reduce symptoms of mild depression, which is important because mental health and testosterone levels are closely intertwined. The sublingual delivery of B6 ensures rapid absorption and immediate availability for the biochemical reactions that need it. Because B vitamins are water-soluble, they're particularly well-suited for sublingual delivery, as they dissolve easily and are readily absorbed through the mucous membranes. Another powerful ingredient worth discussing is ashwagandha extract. This adaptogenic herb has been used in Ayurvedic medicine for centuries, and modern research is now confirming its remarkable benefits for testosterone support. Ashwagandha works by reducing cortisol levels. That's your primary stress hormone. And here's why this matters. Chronically elevated cortisol directly suppresses testosterone production. It's a hormonal seesaw. When cortisol goes up, testosterone goes down. Multiple clinical trials have demonstrated ashwagandha's ability to significantly increase testosterone levels in men. One particularly robust study found that men taking 600 milligrams of ashwagandha root extract daily for 8 weeks experienced an 18% increase in testosterone levels compared to placebo. They also reported improvements in muscle strength, recovery, and overall vitality. When delivered sublingually, ashwagandha's active compounds, particularly the withanolides, are absorbed rapidly and begin working on stress reduction and hormone optimization almost immediately. Now, I want to address something important. All of these ingredients I've discussed, vitamin D3, zinc, magnesium, boron, vitamin K2, fenugreek, B6, and ashwagandha, they work synergistically. That means they're more powerful together than they are individually. Each one supports testosterone production through different mechanisms. And when you combine them, you create a comprehensive approach that addresses multiple pathways simultaneously. This is why I'm particularly excited about sublingual formulations that combine these ingredients in optimal ratios. You're not just getting one nutrient, you're getting a complete system designed to support healthy testosterone levels from every angle. And because it's sublingual, you're getting maximum absorption and bioavailability of every single ingredient. Let me tell you what happened with Robert, the patient I mentioned earlier. After reviewing his labs and seeing that his vitamin D levels were low and his testosterone was on the lower end of normal, we started him on a comprehensive sublingual supplement protocol that included all of these key ingredients. Within 4 weeks, he reported feeling noticeably different. His energy was better, his workouts felt easier, and he was sleeping more soundly. At the 12-week mark, we retested his levels. His vitamin D had gone from deficient to optimal, and his testosterone had increased by 32%. But more importantly, he felt like himself again. That's what this is all about. Not just numbers on a lab report, but real improvements in how you feel and function every single day. Now, I know some of you might be thinking, can't I just get vitamin D from the sun? And yes, sun exposure does stimulate vitamin D production in your skin. But here's the reality. Most men over 50 don't get enough sun exposure to maintain optimal vitamin D levels, especially if you live in northern latitudes, work indoors, or use sunscreen regularly. And even if you do get sun exposure, your skin's ability to produce vitamin D decreases as you age. By the time you're 70, your skin produces about 75% less vitamin D from the same amount of sun exposure compared to when you were 20. So while I absolutely encourage sensible sun exposure, for most men over 50, supplementation is going to be necessary to achieve and maintain optimal vitamin D levels. And when you choose sublingual supplementation, you're ensuring that you're getting the most effective delivery and absorption possible. Let's talk about safety for a moment because this is important. Vitamin D3, when taken at appropriate doses, is extremely safe. The upper tolerable limit set by health authorities is 4,000 international units per day, though many experts suggest that doses up to 10,000 IU per day are safe for most people, especially under medical supervision. The key is to monitor your levels. I recommend getting your vitamin D levels tested before you start supplementing, and then again after 3 months to ensure you're hitting that optimal range, which for testosterone support is typically between 40 to 60 nanograms per milliliter. The other nutrients I've discussed, zinc, magnesium, boron, vitamin K2, fenugreek, B6, and ashwagandha, are also very safe when taken at recommended doses. The sublingual delivery method actually adds an extra layer of safety because you're using smaller doses that are more efficiently absorbed, rather than larger doses trying to compensate for poor oral absorption. One thing I want to emphasize is consistency. These aren't magic pills that work overnight. Hormone optimization is a process. You need to be consistent with your supplementation. Give your body time to respond and support these efforts with other healthy lifestyle choices. That means prioritizing sleep, managing stress, eating a nutrient-dense diet, engaging in regular resistance training, and maintaining a healthy body weight. The sublingual vitamins and minerals we've discussed are powerful tools, but they work best as part of a comprehensive approach to health and vitality. Let me share another quick story. I had another patient, we'll call him Michael, who came to me with classic symptoms of low testosterone, low energy, decreased muscle mass, reduced libido, and a general sense of malaise. He was 62 years old and had been told by another doctor that these symptoms were just part of aging and there wasn't much he could do about it. I fundamentally disagree with that perspective. Yes, aging involves changes, but that doesn't mean we have to accept decline without a fight. We started Michael on a sublingual testosterone support protocol, and we also addressed his sleep, his stress levels, and his exercise routine. Within 8 weeks, his energy had improved dramatically. He'd started hitting the gym again and was actually building muscle. His mood was better, his relationships were better, and he told me he felt like he'd gotten a decade of his life back. That's the power of optimizing your testosterone levels naturally through targeted bioavailable supplementation. Now, I want to address something that comes up often: the difference between natural testosterone support and testosterone replacement therapy. TRT involves getting synthetic testosterone through injections, gels, or patches. And while TRT can be appropriate for some men with clinically low testosterone, it comes with potential side effects and risks, including testicular atrophy, infertility, increased red blood cell count, and potential cardiovascular risks. Plus, once you start TRT, your body may stop producing its own testosterone, meaning you could become dependent on it. Natural testosterone support through sublingual supplementation works differently. You're not introducing synthetic hormones. Instead, you're giving your body the raw materials and cofactors it needs to produce and utilize its own testosterone more effectively. You're supporting your body's natural processes rather than replacing them. This approach is generally safer, has fewer side effects, and doesn't come with the same risks of dependency. That said, there are some men whose testosterone levels are so low that natural support alone isn't sufficient, and TRT may be medically necessary. That's a decision that should be made in consultation with a knowledgeable healthcare provider who can evaluate your individual situation, run the appropriate tests, and help you make an informed choice. For most men over 50, however, natural testosterone support through sublingual supplementation combined with healthy lifestyle choices can make a tremendous difference. And the beauty of the sublingual delivery method is that you're getting pharmaceutical-grade absorption without the need for injections or prescriptions. You're taking control of your hormone health in the most efficient, effective way possible. As we wrap up, I want to leave you with this. Your testosterone levels don't have to decline dramatically as you age. Yes, some decline is natural, but the steep drops that many men experience are often due to correctable factors: vitamin D deficiency, inadequate sleep, chronic stress, poor diet, lack of exercise, and insufficient intake of key nutrients. By addressing these factors and using targeted sublingual supplementation, you can maintain healthy testosterone levels well into your later years. The sublingual method we've discussed today, putting vitamin D3 and these supporting nutrients under your tongue, is a game changer because it maximizes absorption, minimizes waste, and delivers results faster than traditional oral supplementation. It's simple, it's affordable, and it's backed by solid science. So if you're a man over 50 experiencing any of the symptoms we've discussed, low energy, decreased muscle mass, poor recovery, reduced libido, mood changes, I encourage you to get your vitamin D and testosterone levels tested and consider incorporating a high-quality sublingual supplement into your daily routine. Give it 8 to 12 weeks of consistent use and pay attention to how you feel. I think you'll be surprised and pleased with the results. Remember, aging is inevitable, but decline is optional. You have more control over your vitality and hormone health than you might think. The sublingual vitamin D3 approach, along with its powerful supporting nutrients, is one of the most effective tools available to help you maintain your strength, energy, and vitality for years to come. Thank you for watching, and here's to your health and vitality.